Good afternoon and welcome back to Nurses Speak. This is Tonya, the creator of our community forum, dedicated to the voices of nurses of color, but open to all within the profession. This is a safe space where your voice is heard, your story can be shared, and no topic is off limits. Let's break the silence. Today, I have with me a very special guest, and we're going to continue on the topic of self-care for nurses, especially around the time of the holidays. You all know what can happen when we get busy and with juggling work and family obligations and, our own needs. We're going to definitely talk about how we can change the sequence of events and begin to put ourselves first and what our needs are first, as we talked about in the last video. But I'm so happy that Eliane is here with us today. And Eliane is a personal friend of mine. She is the owner of Bodono, a wellness business located in West Palm Beach, Florida. She's a registered nurse with over 20 years of experience, a licensed massage therapist, personal trainer, certified health coach, with additional certifications in plant-based nutrition and motivational interviewing. So welcome, Eliane, to Nurses Speak. And thank you again for joining us this afternoon.
Thank you so much, Tanya. I'm excited. Thank you for asking me to talk to you.
Great. Yeah, so let's start off with this pretty broad question. How would you define self-care?
I would define self-care as a practice to make sure your personal needs are being met and that you can keep a health and a healthy body, mind, and soul.
Mm-hmm. Yeah, and would you say that that's something very important that nurses should be engaging in?
Yes, ma'am. 100%. I feel most of the nurses I know who came into the field because they care about other people and they love helping other people. And they are very, well versed with making everyone feel better. But sometimes, as you know, working in that field is extremely stressful, very demanding, physically, mentally, emotionally, and oftentimes our own needs are really taking the back seat. So yes, I feel self-care is not only important, it's a requirement to be able to survive in life, and especially in this job as a nurse.
Yeah, I definitely agree with that, everything you said. Now, as you said, it's practically in the DNA of most nurses to take care of others, right? But as nurses, how do we recognize when self-care is needed? Because I feel like, I did a video on giving yourself permission to go to the bathroom, right? And it was kind of like a funny type video, but it's pretty serious because I know how it is to be working and taking care of other people and have a million things to do. You got the patients, you got the family, you got the clients, you got the doctors and, administrators. Everybody's like pulling for your attention to do something. And it's almost like, gee, like I just need to go to the bathroom. But, we put that off. And as basic a need as that is, for elimination, I felt like the more we suppress those basic urges and those basic needs to take care of ourselves in the most fundamental ways, that at some point it just becomes habitual, wherein we don't even recognize when we need to take care of ourselves, right? Until we're facing with some sort of a health crisis or something. So, Eliane, from the experiences that you've had, with nurses, and of course, I'm pretty sure you have some nurses that are clients as well. How can we recognize when self-care is needed? Like, how can we recognize when we're not doing such a great job in taking care of ourselves? What are some important signs that may be showing up?
Sure. I would say it starts, there's, a lot of pieces to the puzzle, and that's the same with us too.
Mhm.
Like you said, you get used to kind of not taking care of your own needs, so you don't feel it that much anymore, maybe. However, I feel there is always that little voice inside you that tells you, hey, I still need to go to the bathroom. Hey, I'm still back there. When am I next? When am I going to be next? You hear that voice while you go talk to the doctor, take care of the patient, speak to the family. And yes, we suppress it, but I think to keep the connection and listening to that voice is one step, one piece of that puzzle. And the next step would be to answer that voice, to also then take care of that need. Like I think it should start even before we have a pattern of neglecting ourselves. It should start right in nursing school and right when you get out to work. You have to come first. It's the same, everyone uses that example of you're in an airplane, the oxygen is low, the masks come down. Who do you give the mask first, your child or yourself? Everyone knows it's you, right?
Yep, that's right.
And that should be from day one as a nurse. You have to come first, because if you are empty, you cannot pour from an empty cup. The battery cannot run if there's no energy left in the battery, and that's the same with us. So
Exactly.
I think it should be a pattern of learning to listen to the voice and acting on it. The way I train myself, and believe me, I have 20 years of experience as a nurse. I had 2 burnouts while working as a nurse because I didn't listen to the voice long enough. We have to train ourselves. And the question is, that helped me, is anybody going to die if I go to the bathroom right now? If it's a no, that's what I'm doing first. And then it's like retraining yourself.
Yes, yes. And you're right. It is about retraining, because that is not part of the training, to put yourself first and to take care of your needs first, to eat and hydrate yourself and take some time away from, whatever situation you're facing, to just
Yeah.
decompress, right? That's not taught. You're taught to just keep going, and get everything done for everyone. And then, even if that goes on for a while, it can't be indefinitely, right?
Right.
I mean, there are times when we're in some high pressure situations, but that can't be the constant, that can't be the always way we do things. So, yeah, I mean, I totally agree with you. You have to listen to that voice within you and not suppress it, because it's there for a reason. It's there for your self-preservation, right? For your survival in this game. Oh my goodness. Well, okay, so let me ask you this now. We already know that nurses are busy and tend to take care of others first and so forth. So, let's talk a little bit about how can we prioritize self-care and incorporate it as a regular activity, right? Because now you talked about the retraining. So let's discuss that a little bit, because I feel like if we're taking small baby steps and taking care of ourselves, then that is something that we can begin to develop a habit or a practice of, as you say, so that we're not dealing with, burnout and severe stress, which we know can affect us physiologically in many ways, with high blood pressure, inflammatory responses, autoimmune conditions. Many nurses are facing these things right now, just because, they haven't given that time and attention to their own mind and body. Right.
Yeah.
So, what are some things that nurses can do to incorporate self-care as a regular activity?
Well, I mean, everyone has their own likes and dislikes, so I cannot speak for everyone, of course, but I think it starts in the morning when you wake up. If it helps you that you are centered before you even go to work, make sure you have no music for a few minutes and just do a little meditation. It can be 2 minutes. Just breathe, feel yourself. You have 2 minutes of self-care, so to speak. Very important. Eat something nutritious before you go to work. Best is to eat something that has slow carbs, not like a sugary donut that spikes the sugar and 1 hour later you crash, but rather something like an oatmeal with some fruits and nuts as an example. Mm-hmm. So make sure you got that before you even start your shift. If you're not an early breakfast person and you can't stomach it, then make sure you get a break at 8 or 9 a.m. But then again, that's usually hard. So if possible, take care of your mind, your emotion, and your nutrition before you get to work. Mm-hmm. Once there, we all know this. You take care of patients. Everything is right now understaffed anyway. So the workload is so hard. There's no way you can say, oh, I will have passed my meds by 11 a.m. Oh yeah, then I can take a break. That's just not reality. So I don't want to say, hey, make sure every 3 hours you put your alarm so you can take a break. That's not realistic. Mm-hmm. But what realistic implementation could be, in my case, as an example, I go to work, I do my first round, I'm going to go and drink a glass of water. It takes less than 15 seconds. Jog it down, and then start getting your meds ready, pass your meds. Make sure you go to the bathroom quick.
Right. That's true.
And it's always a good idea if you are somebody who has like low sugar levels easily, and then you need to put some nutrition in your body, keep a little snack bar or like a protein bar, whatever. Mm-hmm. Keep some dry fruits, nuts, whatever you like to eat. Keep it in your pocket. When you're waiting at the Pyxis, you chug that down. Sure. That's reality. Yeah. And definitely make sure you get the half-hour break that you deserve. Mm-hmm. It's very short amount of time that's only yours for the whole shift. Please make sure you get your break. Mm-hmm. And so it goes during the afternoon, Some nurses say they go to the bathroom not because they have to do a business, but they just need a minute for themselves. If you feel a voice that says, I need a minute, mm-hmm. Go take that minute. Step outside, go outdoors, step on the balcony, go into the bedroom, go somewhere. Breathe, calm, take care of that need, and off you go again. And I believe the more you do all these tiny little things, the more your nervous system knows that you are taking care of yourself too, mm-hmm. And the less issues will arise. And of course, physical needs like, again, nutrition, hydration, that's just a must. And you have to fill that.
Yeah. And just that little time alone, stepping away, just to decrease all that mental stimulation, those demanding voices out of your head for a moment, right? This way you can just listen to what you need and hear that voice that's within you, as you said. That's definitely vitally important. I can tell you many times I've been working, not even working. And it's funny because we think that even in the inpatient settings, it's understaffed and it's very overwhelming, it's physically taxing. But believe it or not, for those of us working at home, because I'm in a work at home situation right now, people tend to feel like they have even more access to you, right? So it's like there's even more you're being asked to do, more to take on, because they already know like you're a captive there with just a computer and a phone. They can come at you from all directions every 5 minutes. It's like, they get it, there's the micromanagement of everything, and every minute what you're doing is recorded. So it's like, it's always coming at you in one form or another, that type of stress, because of the volume. It's sheer
Right.
volume of what patients that we're dealing with, right? I mean, and even realizing that even with COVID taking up a lot of, patient care beds, there's still a sick population out there that have many other conditions that needs to be addressed. And here we are with another, wave of this new COVID variant, where we're seeing the numbers go back up again. And then you're still having the decline in those people getting treated for their other comorbidities, right? So you have now hospitals again reducing or stopping their elective surgical procedures, and things like that are going on. Different areas are closing. There's still this controversy of vaccine versus no vaccine going on in many places. And, that too can create a lot of stress, because if you're out there in the front lines and, you're vaccinated and you have your mask, and everyone you encounter, you don't know what their status is, right? So you're always going to be facing some degree of risk, right? So I feel like it's really important, like you said, to keep up with the hydration, the nutrition, and just the overall the mental rest that we need. Those times when you have to take off a mental health day, when you just can't deal with it anymore, and we need to begin to give ourselves permission to do that, because that's the only way you can be functioning long term. Otherwise, like you said, you're destined to burn out and not be any good to yourself or anyone else. So definitely these are important things. So I know your focus now is on massage therapy, personal training, coaching, and plant-based nutrition. So can you just share with us some of the things that you do with your clients as it relates to self-care activities, and particularly in improving their health and wellness overall? What are some of the services that you provide?
Well, let's start with nutrition. I provide meal planning, tips how to batch cook so you can bring your own lunch to work and your snacks, and that they're going to be healthy, nutritious, but also delicious in a way that you like. Not everyone likes the same food, but the more vegetables and fruits we eat and the more we can incorporate that in our meals, the better for our bodies. Of course, we all know that, right? Vitamins, minerals. And so I do meal planning and cooking tips, cooking workshops. Otherwise, everyone, again, has their own likes and dislikes. So to be personally taking care of your own self, you have to know what is good for you, what feels good for you. One person might love to go for a swim. So on your day off, make sure you go for a swim because that makes you feel good. Somebody else, they like to go dancing in the disco. Hey, why not go dancing if it makes you feel good?
Sure.
So find whatever, feeds you with positive energy, with some good vibes, and do that. Make sure you schedule that into your week, or at least every other week. So you have basically, instead of all giving, you can take a little bit whenever that time comes.
Right.
Definitely, a lot of nurses have children, family. As soon as they come home, there's the second job waiting right there, right?
Yeah.
So I don't know. I don't have children, so you might have more ideas, but the way I work with clients, we find that, neighbors, they can team up and say, okay, today's my child-free afternoon. Tomorrow I'll take your kids. So each of us can have our own me time. So however it is, get your own me time, schedule something that brings you joy, that is good for you. And then, of course, movement, a very important part. Yes, we move all day up and down the hallway, but it's a very repetitive movement. We're always bent over forward. So anything that helps to really work the full body, stretching, stretch open that pec,
Yep.
body, neck, get a massage, go get a mani pedicure if that brings you joy, whatever it is. Have your husband massage your feet in the evening at least once a week. Why not? You know, we have to ask for what we need and then we will find a way to get it. So we have to ask for it.
Exactly, exactly. Yeah, and one of the things that I've started to do that I find very helpful too in de-stressing is going out for walks. And
Oh,
yeah, walks in nature, maybe like a little, maybe an hour, a 1 hour hike, something like that. Because where I'm at now, there's plenty of forests out here in New Jersey. So I could go into my backyard and, put in a
yeah.
good half a mile walking up in the woods. And that's like, uphill. So you're kind of getting a little cardio and strength training in there while you're moving. And it's
That's,
out in the fresh air and it feels so good. I think a lot of people, because they use their car so much, depending on where they live, kind of forget how simple things can begin to feel so good when you're just doing it and you don't have anything else to be thinking about. You
I
can
love
just,
that you say that.
yeah, observe the trees and the birds and the different
Absolutely.
foliage on the ground. Just look up at the sky. And it doesn't cost anything, right? So we do have things that we can do, and it's at every level, because when we talk about self-care and you know from the traditional sense, many of the things that we can do, like you mentioned, dancing and swimming, these are things that are not cost prohibitive, right? um because everybody's budget is different for what they can afford to do. And so I just feel like the more we talk about and share about things that we can all do to take care of ourselves, the better off we'll be, because somebody has to be telling our fellow nurses, hey, stop what you're doing and take a self-assessment and see where you are right now and what you need to work on to improve your own condition.
Yeah.
Because if you don't put yourself first, nobody else will. And as we all know, we're very easy to replace. Despite what they're talking about nurses shortages, there's a shortage, but at the same time, if you don't show up for work, somebody else will do the work. That's basically how it is. That's the truth of the matter. So yeah, I think that you know our viewers would really appreciate this information sharing. And I'm definitely looking forward to those comments coming into the chat and the people letting us know what they think about self-care, how they're managing self-care, and what they would like to explore in terms of doing something new. Because sometimes we don't realize how good we can take care of ourselves by doing something we have never done before.
Yes.
So trying something new could be a great discovery. You might find out that you have a real niche for something and want to make a practice out of doing it, or engage with a partner or a friend to do something together to take care of yourselves. And those are all great opportunities to just continue on that journey of wellness.
100%. I love that you bring that up. That's very important. I actually, when you plan with clients, sometimes you plan out a few months ahead things that can help you with your wellness and self-care. I feel once a month, do something that's daring, that's maybe you wanted always to do something like that, but you never did it. You never had either time or never had the guts to do it. Just try it. And just that act of, it's almost like a stimulus, stimulating something in you that hasn't been there before. it can bring a whole new side of you to life.
Yeah, yeah, definitely, definitely. Wow. Well, okay, it's been great. Eliane, thank you so much for sharing that. And I would just like to let our viewers know that Eliane will be coming back with us because we have a few more topics that we can discuss with her in her areas of expertise. One being travel nursing. She's done that for a period of time. And I know that we have some travel nurses out there watching these videos. So please put your comments in the chat, any suggestions for things you want us to talk about with regard to travel nursing, we can. I first met Eliane in New York City where we worked together several years ago. And she's a lot more free and adventurous than I am. So I know she's been around this country a couple of times. So I'm even curious to hear about her travel nurse experience. And from there, we're going to go on and talk about, her journey into entrepreneurship. So these are going to be some exciting videos coming up. Stay tuned. I invite you again to like, subscribe, and share, and turn on your notifications for Nurses Speak. This is your channel. This is your voice. You matter. We want to hear from you. Thank you, and bye until next time.